Hi, my name is Dr. Cameron Chesnut, and I practice in the beautiful Pacific Northwest in Spokane, Washington. Today I'm going to talk about a question I very commonly get in my practice, and it relates to lower eyelids. It's what makes a good candidate for filler versus what makes a great candidate for surgery. And so when we really break this down and we look at how it works out, more patients end up getting filler than they get surgery, which makes sense. Filler is a much simpler option to go with. But the question becomes, is that because these people are better candidates, or that's just what's happening with them? So when we really break down what's happening in the lower lid and the cheek junction, we have to look at what is actually coming from a lack of volume, missing volume that can be replaced with filler or fat transfer, whatever that may be. In reality, that's a very small minority of patients, less than 20%, probably close to 10% of patients that are really truly just lacking volume in their lower eyelid. Much more commonly is that we'll see the bagging that exists right below the eyelid, which is actually fat from the eye herniating outwards. And when we have that combination of things, that's where surgery really comes in as a better option to be able to address the changes in those patients. Surgery gives us the option to reduce the fat pads that are there, or in my personal practice, I really like to repurpose and reuse that fat to drape it down into the cheek to fill the volume below. So that allows me to take the extra fat that's there and use that fat to fill the volume deficit below, accomplishing two things, both fixing the mountain that's there and filling the valley that's next to it. When we talk about a pure filler candidate or a fat transfer candidate, that person doesn't have as much of the bagging above. Most of that volume loss is down below, and we can replace that very beautifully and very simply with filler or fat transfer in a non-surgical fashion, but the limitation there being the only thing we can do is add volume where volume is missing. So with a lot of patients who end up getting filler, they're only treating part of the problem that they have. They're not actually kind of treating all of the aspects, and so results can be really good, but often suboptimal in comparison to surgery. If you have any questions about whether you're a good candidate for surgery versus filler, please reach out to me on my Instagram and I'll be happy to answer.